I've been asked by colleagues about my rationale for this research and my interest in this topic. And I've worked as a professional therapist with hundreds of men, women, and youth who have sexualized attachments. And usually they came to my office expressing pain, conflict, and confusion. They often struggled with childhood difficulties that to them seemed very relevant to all of their struggle and their confusion. They shared private and sometimes traumatic stories of events that they insisted had contributed to their current pain and struggle. My attention was piqued when Dr. Lisa Diamond wrote her book in 2008 about sexual fluidity. And in it she discussed her observations that some women would shift in sexuality and attraction, and that observation really pointed her towards this whole concept of sexual fluidity. Her research enhanced my clinical observation that some people's sexuality was influenced by various emotional dynamics. I explored this issue. Concepts of secure attachment would come up in the research, insecure attachment, defensive attachment, anxious attachment, and those topics kept coming up in what I was looking at, as did the concept of sexualized attachment that includes issues such as trauma bonding and trauma repetition or trauma reenactment. I was then again intrigued when Rich Saven Williams published his book, Mostly Straight, in which he explored sexual fluidity among men. And he asserted the same observation as Lisa Diamond and explored biological and psychological factors that combine to influence sexual attraction. Similarly, Neil King observed emotional patterns which influenced sexual patterns and sexuality. He noticed that arousal patterns were often developed through emotional dynamics and over time became imprinted. And so I spent several years collaborating with other professionals, some who felt strongly about environmental influence, some who felt strongly about genetic influence, and in some instances they had intensely political or religious differences. But I listened and I learned from both positions, and after more research decided to write this workbook about healing and recovery and the whole topic of sexualized attachments, which I think has been overlooked over the past decade. So my fear is that many times adults and youth will label themselves as abnormal or broken, or they take on an identity based on what they're experiencing, sort of the symptomatic things happening to them related to sexualized attachments, rather than understanding themselves on a deeper level. I think healing and recovery is going to be very important for those who struggle with sexual attachment, regardless of the direction a person takes in their life and the choice they make and the identity they take on themselves. To be a whole person, you're going to want to address healing and recovery aspects of the sexualized attachment issues. Help them understand themselves, help them find healing, satiate attachment needs, deficits, and heal attachment wounds that may have occurred. We can't overlook those things if we really want to help people.